In GP surgeries, we get asked all sorts of questions. We may not need to know all the answers, but we do need to know how to help people find them. We hold lots of information about people. Of course, the main reason for this is so that we can care for them. But all this information also provides the opportunity to plan local services and research new treatments. The majority of people are happy for their confidential patient information to be used to improve services. But of course, some people would prefer that their information is not used in this way, and they can choose to opt out. The NHS has launched a campaign called Your Data Matters to the NHS. In May 2018, the strict rules about how data can and cannot be used were strengthened. Patients can choose whether their confidential patient information is used for research and planning. If a patient does not want their confidential patient information to be used for research and planning, they can choose to opt out securely online or through a telephone service. This preference is not set through the practice or any other healthcare provider. Patients do not need to do anything if they are happy for their confidential patient information to be used. They can change their mind at any time, and they should be aware that there are some circumstances where the opt-out will not apply. NHS Digital have produced information to explain this service to patients, including when their preference will and when it will not apply. Leaflets to give to patients and posters to display in your waiting room are being sent out. Your practice will have these resources to inform patients about how their information may be used and how they can make their choice. In addition, the NHS Digital website has a suggested text to include in your practice privacy notice regarding the National Data opt-out. To support practices with the National Data opt-out, the RCGP has produced a number of resources, including an e-learning module and a practice toolkit. The e-learning module takes about 30 minutes to complete and gives an overview of the purpose and implementation of the National Data opt-out. The toolkit offers more detail and can be used as needed to learn more about specific aspects of the use of information and how the National Data opt-out works.